Good afternoon, everyone, and welcome to today's Accreditation, Certification, and PCMH Huddle series. My name is Allison Bishop, and I'm a Quality Improvement Advisor for the PASS team here in Montana. And with me today is my colleague, Jimmy Norris, another Quality Improvement Advisor for the PASS team in Oklahoma. Today, we'll be reviewing the PASS Crosswalk of Accreditation Programs tool. Next slide, please. Our agenda for today is to review the PASS Crosswalk of Accreditation Programs tool with time after for an open discussion in office hours. Next slide. And we want to welcome you to today's Accreditation, Certification, and PCMH Huddle series, session number 5. After today, there will only be 3 huddles left. Next slide, please. During last week's session, there was a request for PCMH patient-facing resources, and Natasha Green is going to speak on what some of the facilities in the Great Plains area have done.
Thanks, Allison. First, I'd like to go ahead and introduce Denise Klippel, who will be speaking as part of the Standing Rock Service Unit. She's the Quality and Risk Manager there. So Denise, if you're on the phone or joining by phone, you press *6 to unmute, and she'll talk about some of the resources that their team put together for PCMH. Denise, are you able to unmute? We'll give her just a second. Nope, we can't hear you, Denise. Go ahead and unmute your phone and then press *6 one more time. She'll be, Jonathan, if you could unmute her, she's the 701-854 number 3831.
How about now?
There you go, Denise, we've got it.
Perfect. Well, hello, my name is Denise Klippel, and I'm from the Standing Rock Service Unit in Fort Yates, North Dakota. And this is some of our PCMH patient resources that we use here. One of the things that we made was some posters, and we came up with a little catchy phrase of "Who's your doc on Standing Rock?" to kind of show who our teams are. And so when patients are coming in and they haven't associated themselves with a primary care provider or a team, we post these in the rooms and in our lobby and around town so that people can see who our providers are, know the teams that we have, and some contact information. There's a team phone number that we have there. So the Team Buffalo and Team Eagle and Team Owaste both have numbers that patients can call to talk to anyone on those teams. So we came up with Who's Your Doc on Standing Rock, and it's been quite popular. Another thing that we do is we have a primary care medical home brochure that we hand out, and that's the next little paperwork on the side there. It talks about our mission and our values and our goals. Talks about managing patient care, what a primary care medical home is, and what we do here, and kind of what our teams do. We also have all of our providers have pictures in the lobby with their names on them, and then we have bio cards underneath where patients can take them. And the bio cards talk about their history, what they're specialized in, where they went to school, and things like that. And that's for patients to take to help pick a primary care provider if they don't have one. And then we also have little reminder cards that we made with our team names on them, phone numbers on them, the provider's picture, so that when they do have a visit, they can write on the back, like, "I want to see you back," and give little instructions. So those are just kind of some of the little tools that we have and resources that we use here at Standing Rock to kind of keep reinforcing a primary care provider, the primary medical home model. I think, did I mention them all? Did I forget a few?
No, you did perfect. Thank you, Denise. I don't know if anybody has any questions.
We're getting a lot of likes in chat. I love it.
It is a really cool, I love that slogan. It's great.
So the bio cards you mentioned, I have a question.
Go ahead.
Are they like little, either like playing cards or little business cards that are on the bottom of each of the frames that you set are out in the either waiting area or the hall?
Yeah, so the pictures are they 10 by 12s, I believe? Is that the size, Natasha? And
Yeah, I
then
believe
they're
so,
framed,
something
and then
similar.
right below them, we have like a display, like little holders, and the cards are probably by 4 by 8s, would you say? Like, or 6?
Oh,
They're like
okay.
oblong.
Oh,
Yeah, they're like oblong. So, and it has the picture on there and then all their information. We don't have an example, do we, Natasha? Huh?
I can pull one up quick.
Okay, yeah, that'd be nice. People take them and like take them home with them, and they seem to like that. And then when we did create that bio card thing, we had a little template that we used, and we encouraged the providers to tell them something about them, like I like biking, or just something about that would help people connect with them. So, and even I learned about some of our providers, like I had providers that like to bike and all kinds of hunting and sports and all kinds of things that I didn't know that those providers do. So it was kind of nice to see the human side of them besides just them and their white coat and their business. That at work, it was kind of nice to see that what they're interested in afterwards. So yeah.
Jonathan, if I could share the screen, thank you. This is an example. If it's sharing the right screen, can you all see the bio cards?
Yep, we can see that, Natasha.
Okay, perfect. Thank you. This is just an example of what Standing Rock's bio cards look like. And you can see it varies what their providers put in there, but they just put in some history. Like this one puts in about how they did basketball or where they're from, when they started with the facility. This one mentions how this one's part of the Turtle Mountain Band of Chippewa and originally from Belcourt, North Dakota, just to personalize it a little bit.
Natasha, this is for Denise from Laverne Parker. She says she loves it and she would like to use your format if that's okay.
Oh, absolutely. I will share anything with you. Actually, if you want the templates and stuff, that's something we have, right, Natasha? Like we could just send her they could just like fill them in.
Yes, reach out to your PATH QIA and for any resources. And if you're not a part of PATH, you can reach out to the main PATH email. Becky, are you able to put that into chat so people know where to reach out to? And I think as some of the resources we send out after our huddle, we can make sure to get resources out to those who are looking for some of these examples.
Yeah, sure. Share that template with anyone who wants it. It's always a work in motion. As we get new providers, we just keep adding on there. So it's easy to do. So yeah, Natasha will get you that from Becky and feel free to use it.
Thanks, Denise. Okay, so we'll go ahead, Jonathan, move on to the next slide. Okay, and so next up we have Crystal, who will talk about some of their materials that they put together for the primary care patient-centered medical home. So Crystal, are you on the line?
Can you hear me?
Yes.
Okay, perfect. And hope this can work. Okay, so this is our patient-centered medical home. I guess how we're letting our patients know about it. The document on the left is our poster. We have this poster hanging up throughout our facility, just describes what primary care is. And then the other document is our brochure. And after seeing Denise's, I think we need we need to jazz it up a little bit. So this is what we have currently. Actually, this is not, we actually updated this a little bit more since our PCMH survey. They said that we should also put our mission, values, and vision statement on there. So that has been added. I just didn't have a copy of it. So this is what we have here. We were planning on doing the bio thing, but we did not get around from that. So hopefully, hi Laverne. Yeah.
It's a small world, but you pointed out something I think really important too, where you had just had your survey that you guys got your PCMH designation on, and they had provided feedback to your brochure, which I think is really helpful.
Yep, they said that we should add our mission, values, and vision statement to it. So that was we did do that. I just didn't get a copy of it. Like I said, our outpatient department nurse manager has that, and she's been out for a little bit. So So here's our information that we have. Yeah.
Great, thank you, Crystal. And I really like the poster too. I think that kind of, it's displayed, you have the poster out in all of your clinic waiting areas, right?
Right, I think we put in ER, we have it down the hall, we have it in our front entrance here by administration, we just kind of put it everywhere.
Excellent. Jimmy, any questions or comments?
There's a comment from Crystal. Hi, Crystal. I'm her dad's first cousin, so there's a little family reunion going on there. And I love the "and welcome home" verbiage from Nancy.
Yeah, I love that too. That's really catchy. Thank you, Crystal, for sharing.
No problem.
Okay, and then last but not least, and Jonathan, I'm going to steal the screen one more time for Dr. Garraza. He was going to speak about what the team has been doing or working on for their PCMH outward-facing materials. And Dr. Garraza, I do have an example of one of your brochures that I was going to pull up, and I thought maybe you could talk about the process of how you've been getting to and how you've modified each one of your brochures to fit the needs of your community.
There you go.
All right, can everybody see the brochure? Yep.
It looks good.
Looks good. Excellent. And Dr. Garraza?
Zoom out.
We can hear you. Oh, I was gonna say we can hear you too, so you're perfect. Okay. There you go.
Great, thanks. One of the things, so this is just a trifold that we can easily print out of one of our printers. And what we've been asking, if you've noticed down on this left side, I really like that the previous one where it had the office hours. I really like that idea, and I think we might look to see how we can incorporate that. But we have our office hours here, and this one doesn't have, yeah, it does. It's got, and what we try to do with some of our other brochures is just a single number so they don't have to, kind of get lost in between like the sea of numbers, so they know that if I've got an access line or an appointment line, those are the only two things I kind of need to know. That was sort of what we were thinking with that. And then do we have the other side? I think that's pretty much it. One of our big things is that we don't, we get so much turnover here that having the names, just that alone was, we think is helpful to our patients. And what I've been asking our providers to do, at least here on the service unit, is handing these out with your visit summary. So we have to hand out our visit summary anyway, even if they've seen them before, just sending them home with one of the brochures and making sure they know that the number's there if they have any questions is what we've also been asking our providers to do with those. But other than that, just we haven't done as much modification. You guys, yours up. The ones I've seen here look really polished and very doors, but this is
Oh, they're all great and they're all unique.
Absolutely. I think this looks great. I just wanted to say this is Nancy, and I'm the path partner for Dr. Garraza's team. And I just wanted to say how proud I am of all of the hard work that their team's been doing with regards to PCMH. They meet every single week and they have a very large group, and Dr. Garraza has been their fearless leader. And a lot of their team members are on the call today. So thank you, Dr. Garraza, for sharing.
Thanks, Nancy. And thank you, everybody, for sharing. This is what these PCMH open office hours and huddle sessions are about. So we appreciate you all sharing resources and making those connections. So thank you again. And we hope that this was what you were looking for when wanting patient-facing resources. So again, if you have additional requests, please go ahead and type those into chat or ask those during the open office hours. But I'll hand it back over to Allison. Thank you.
Thank you, Natasha, and thank you, Denise, Crystal, and Dr. Garza. Sorry if I'm mispronouncing your name, for sharing your PCMH resources with everyone. Jonathan, next slide, please. So the objectives for today's session are to review the crosswalk tool in detail and the intent behind it, provide an overview of the tool, and then lastly, provide a demonstration of how one could use the crosswalk tool. The slides that were sent prior to today's huddle do not contain the link for the crosswalk tool, and new slides will be sent out with an active link for those of you to download the tool after today's session. Jimmy is also putting the link to download the tool in the chat. Next slide, please. This accreditation, or this Crosswalk of Accreditation programs tool contains CMS COPs, or conditions of participation, Joint Commission PPS hospital standards, Joint Commission CAW hospital standards, and AAHC, or the Accreditation Association for Ambulatory Healthcare Standards. The idea behind this crosswalk is to assist you and your facility with self-assessing on what needs done to transition from one program to another. And also to help you prioritize which standards would pertain to your facility as you move to a different accrediting program. The crosswalk starts with the Medicare CMS CFR number and what the equivalent under Joint Commission PPS hospital standards and then the equivalent to under Joint Commission CAW hospital standards and the equivalent under AAHC. So next slide, please. So we would like if anyone is, oh, go back one. We would like if anyone is transitioning from one accrediting body to a different one to please chat in which one. And an example of this is transitioning from Joint Commission accreditation to AAHC, or Accreditation Association for Ambulatory Healthcare.
It looks like Kimberly Jones they're transitioning to Joint Commission to AAHC.
Thank you, Kimberly. This tool might be for you. Is anyone else transitioning?
Allison, I was going to also add, I put it into chat too, but I know not everybody's looking at chat. This could also be a helpful tool if they're transitioning to from a PPS to a CAW, or vice versa. If you're from a ambulatory to a PPS, or a CAW to a PPS hospital, this will also help you just because it has the different CMS and Joint Commission standards in there.
Yes, thank you, Natasha. Hospital to CAW. The clinics in the Billings area are transferring from AAHC to Joint Commission. Thank you, Sarah. All right, well, if anyone else is, oh, we're transitioning from hospital to CAW. Thank you, Jonah. Okay, Jonathan, next slide, please. So when you open the tool, you'll notice that there are several different tabs. There's a total of 8 tabs at the bottom. There's ones that are sections 1 through 5, and that's where all the standards that we've been talking about contain or are at. And then there's the cover page, instructions, and table of contents. Next slide, please. So the first tab is the cover page. This page just gives a general description of the tool and the name. Next slide, please. The table of contents is where you can navigate the different sections of tabs by which PPS CFR number, if you know what it is. If you don't, no worries, we're going to show you how you can maneuver through the tool with finding and searching through other things. So next slide. So now we're going to demonstrate walking through the tool. Jonathan, if I could share my screen. Is it sharing?
Yes, we can see it.
Looks good.
Okay, thanks. So this is what the section tabs look like. The CFR number, I switched them around earlier, but CA, PPS, HHC equivalent. And that's how each of these section 1 through 5 are set up. Table of contents, there are instructions in here. We didn't go over those because I'm going to be walking through them. And the cover page. So a way to maneuver this, so if you, just as an example, if you were to switch from Joint Commission CAW accreditation to a AAAHC, you can look and find which standards you used to need on your radar that you might not need anymore. And if you know what the standards you monitored for Joint Commission CAW, there's an easy way to find them in the tool without having to go through these CFR numbers and looking up those equivalents. So on the home ribbon, which is where I'm at right now, right here, the home ribbon, there's over to the right, there's a magnifying glass and it says find and select. And so you'll want to click that little drop down and click the find button. And I was in here earlier, so we'll go like this. So if you haven't been in the find and replace box, this is what it will look like when you first come into it. And so the one thing that I suggest doing is going to this options button right here. And that gives you more options on widening your search. And what I like to do is I like to change this within from workbook, or from, it's usually sheet, I'm sorry. It's usually sheet to workbook. So when it's in the workbook, that means you're gonna search the whole entire workbook. If you're just in sheet, it's only gonna search and show you what's within this sheet. So I like to do workbooks so I can find everything. And I'm just gonna use, let's see, what's a CAW one? This LD 040101-EP2. We'll type that into the search box. And you don't have to type it exact, like capital letters. Capitalization doesn't really matter. And so first I'll do the find next. And so when you click the find next right here, it will take you to the first one and you can kind of see that it has a green box around it. And if you keep hitting that button, it takes you to where the next one is. And then where the next one is. And the next one, and the next one. An easier way to do this for those that have a lot that are within the spreadsheet a lot of times is to click this find all button. And when you click that, it shows, I'll make this bigger. It shows this list down here of every cell that contains this LD.04.01.01-EP2. And so what you can do is we'll click on this one. It says that it's in this workbook, the name of the workbook that we're in, which sheet it's in or which tab. So this one's in section 3. And then what cell it is. So E110. So if we click that, it will take us to E110. And you can, if you keep clicking on other ones, it keeps moving for you. So now you see we're in section 4 and it has taken us, now I gotta find the green box, to E642 of section 4.
So by searching this way, Allison, you can essentially see what all that specific standard crosswalks to in an easy way. You can have a nice list of it.
Yes, yep, that's correct. And then you can click on them to see, so if you're switching from CA to HHC, let's see, that's column C. So we'll click on a column C1. And there's my green box. So right here for this standard for this CFR number and this cost standard, there's nothing that falls under that for HHC. So let's see if we can find one now that does. Nope, that one doesn't either. And this one doesn't either. So you can look across, and if there's a gray cell over there, that means that there's nothing that crosswalks to, for this example, to HHC. And you can go through all of them, and I'm not seeing anything that crosswalks from LD040101-EP2 to HHC. I could be wrong. Oh, now I'm stepping on my tongue. There is one right here. So that's basically kind of how you maneuver through the find and search. I personally like doing it this way because it gives me a list of everything and might not make you dizzy. If you're doing the find next, you might get dizzy when it keeps moving through your spreadsheet. Are there any questions?
This is Jimmy. Roberta Villa, she chimed in. She says Kayenta is transitioning from clinic to hospital. So if they were AAAHC certified, they could actually go backwards and look at the crosswalk from AAAHC to the PPS, correct? Or the CAW?
Correct. Yep. So so you could put, so we could do an example of from the AAAHC column is, one is, let's see, 2.E. We'll just do 2.E. And then if you search find all, you will see that the 2.E, I think those are the chapters. I'm not super familiar with the HHC standards, but the 2.E ones, they show up in all these different cells. And you'll see like, so this one right here, for example, it says 7.2.E. So that's showing up because we have just 2.E in our search box. There's nothing else. So if we were to put .1 and find all, then it's going to show those that have the .1 after it. And you can make it so that it matches what you've typed in. So match case. Couldn't find what you're looking for. Couldn't find what you're looking for.
Another question in chat by Marjorie Rogers. Would it be possible to add the TJC ambulatory standards to show a crosswalk between the ambulatory standards, TJC to AAAHC?
That's a great question, Marjorie. Actually, with working in the Billings area, we've had that question as well. And it is planned to be put in there in the future, in a future crosswalk edit, I guess, or update. We are planning to update it with that. They just aren't in there as of right now.
Great, Allison. There's no other questions in chat.
Does anyone else have any other questions?
Hey, Allison, I know we're hitting the open office hour time frame, but I just wanted to ask a question about, like, if I was switching from being a PPS hospital to a COF facility, and you kind of hit this a little bit, showing with the search and find function, but can you just show individuals just one more time again how you can go across from left to right to figure out from the white to the gray areas which ones you should be focusing or prioritizing on? So if you see one that's in the left-hand column and it continues on to the next one, then that's something that you should prioritize. And then the ones that have a gray space, you don't have to prioritize those because they're not crosswalked to the other areas if you're converting.
Yeah, so let's say you're going from CA to AAAHC and you're going through this and you're like, okay, so what do I need to focus on? What do I need to pay attention to? And you'll notice that there are a lot of these standards that there are multiples of them throughout this, and that's because they're based off of this column A, this CFR number. And so you might find like LD01, 03, 01 EP5 crosswalks to the AAAHC equivalent of 2.E, but maybe down below it might not. But that's something where, so like then the 2.E.6, if you look towards the CA column, column C, there's nothing in there. So that this 2.E.6, when you're a CA, might not be on your radar, but now that you're going to AAAHC, it should be on your radar and you should prioritize that. Does that answer your question, Natasha?
Yes, thank you. I appreciate it, Allison.
Yeah. Are there any other questions?
I don't see any in chat. Becky asked, did you review where to find standards that don't directly crosswalk? For those AAAHC standards that don't crosswalk to TJC PPS, how can I use this tool to find that info?
Great question, Becky. So those are in here, and those are actually in section 5, the very last tab. And I'll go to the top. So they are towards the bottom of this section. I'll try not to scroll too fast, because there are quite a bit. They're towards the bottom. You'll see that there's quite a few right here. They start on line 296 in column G, and these are the ones that we didn't find that crosswalk to any of the other accreditations. So section 5, 296 is where those start and go to the bottom. All right, I will stop sharing, and since we're close to our open office hours, and Jonathan, if you want to reshare the presentation. So now it's time for our open discussion. For anyone who's willing to come off mute or chat in any questions you have regarding to the crosswalk, or if this is stemmed any other questions regarding accreditation in general, we would be happy to answer them. Yes, or PCMH, Natasha.
Laverne Parker asks, are any facilities doing the dental PCMH? So if you are, you can chat in. You're doing any of the dental PCMH. And also Heather Black says, as someone who is assuming responsibilities for PCMH onboarding, how do I know what tasks are assigned to those who came before me? That's a great question too. If anybody has any insight for Heather.
I can answer that for Heather if no one else has any anything that they'd like to share.
Go for it, Natasha.
And then we can answer the dental one too. But if you know, again, this is just a place for colleagues to come and share, again, what they're doing to help each other out too, and to share best practices or promising practices. So please share away. But it's difficult when you're assuming responsibilities for PCMH onboarding or just PCMH in general. Unless there was a way to track it, there's really no way for you to know unless they gave you an orientation. So on our website, I don't know, Becky, if you can find the link on our website to paste into chat for us, or Jimmy, but we have a PCMH self-assessment tool that you can start with to help assess where your facility currently is. So that way you can start there. So if you don't have information and you are kind of lost where you start with, the first step is to, one, do that self-assessment, include disciplines like the providers or provider champion, nursing champion, clinical application specialist, someone who can give you that insight, complete that self-assessment and start fresh. The second thing that you can do is to ensure that doesn't happen again is to make sure to follow the processes and develop a project charter. So you identify who those team members are, and so you can save that and have that located. So that way, again, if someone comes in, they can read the project charter, they can see who's assigned to what and who is a part of the team. And then of course, if you have that action template that Becky's going to paste in the chat, then you can record what you're working on and who's doing what and the timeline of all of that as you work on that. So I hope that that was helpful. And Becky's grabbing that link for you. Thank you, Becky. Oh, you both did it at the same time, Becky and Jimmy. So Heather, I hope that answered your question. I know it's not the greatest news, but the best thing is just to start fresh with it. And then Laverne, dental facility. So a lot of the hospitals are under one CCN code. So when Joint Commission, the accrediting agency, comes in, they kind of PCMH designate the whole facility as one, but I don't know if anybody's specifically worked in dental that they can share. Sorry, Jimmy, I'll let you take it away with the questions.
Yeah, we have a question for those doing the PCMH. Do you find an advantage from transitioning accreditation? And that's from Ellen Garza.
Dr. Garza, could you add a little bit to that? What you mean by transitioning your accreditation?
Well, the transitioning from a joint commission to, what was the AAA?
Oh, AAAHC?
Right. I was wondering why one would want to, or what was the purpose of it? Does my question make sense? Because it was.
Yes. Usually the facilities in collaboration with their area offices decide which accrediting agency to use. And so AAAHC is often used for ambulatory facilities. and those who are hospitals.
I see.
Okay. Usually, and I don't want to speak for everybody, but we typically see DMV or Joint Commission for those accrediting bodies.
Okay. So if like the facility are either changing their services for their community, then the various accreditation has to be used.
Right, right. And
okay.
Joint Commission does offer just outpatient or ambulatory accreditation as well. So it just depends on, again, the area office, who the leadership is most familiar with, and then they make a decision collaboratively to decide which accrediting agency is best for them.
Thank you.
You're very welcome.
Thank you, Natasha. Does anyone else have any other questions? And Heather, I have worked with the Blackfeet Service Unit, and so I will dig through my files. I might have some tracking spreadsheets made that I had made previously for the previous outpatient supervisor, Margaret Ann, and so I'll look through and get back to you on that.
Hello, everybody. This is Laverne. On the dental portion, you said most facilities just include dental in their PCMH. Do they just add a dentist to the team? Is that how it's done?
So it depends on your providers, but usually when it comes to the care team, we talk about the holistic approach. So it's not that they necessarily have to add a specific dentist. They'll just say that dental is a part of their PCMH care teams. But usually when the surveyor is coming on site, they're surveying the outpatient department and looking how they integrate the different members of a care team. So behavioral health, dental, any other community providers who should be integrated as part of their care, specialty care.
Oh, okay. We're going to be surveyed in about 8 weeks, but the surveyor asked us if she wanted us to look at our dental PCMH. So
are you doing it with Joint Commission?
No, AAAHC.
Perfect. So what I would do then is make sure that under the AAAHC section for the dental part that you review those chapters and just make sure that you have those standards in place and that your team feels comfortable to speaking to those.
We're just now moving toward PCMH. I mean, we're still going to do we still have to do the beginning work like the self-assessment and all that. But I thought, how are we going to integrate all the other, behavioral health and all the other services that we do offer here at our clinic? So, but thank you, that does help.
Absolutely. I don't know if anybody else wants to speak to how they integrate the other disciplines, or if anybody else would be willing to speak to how they integrate some of their other disciplines into their PCMH. I see, Crystal, you're still on. Did the surveyors, I know you use Joint Commission, so it's a little different, but did the surveyors ask you a lot of questions about dental while they were on site?
No, we didn't do our dental.
Okay.
Ask a lot about is infection control, so really prepare on that part. Like what our processes are now with COVID, and yeah, they really asked a lot about that.
Yeah, not next week, but in 2 weeks, Nancy McDonald will be talking a little bit about what surveyors are really hitting home with during the survey process, even if they are coming for PCMH designation.
right, well, we're coming up on time, so thank you everyone for all the questions and attending today's session. Jonathan, can you go to the next slide, please? So we just want to thank you all for joining today's huddle. Next week on July 14th, we are having session number 6 at 2 p.m. Central, 1 p.m. Montana. And that's going to be on the QAPI program yearly review. He also asked that you complete the huddle feedback assessment, and Jimmy did put that link, that SurveyMonkey link, in the chat. So if everyone could fill that out, that would be great. That helps us know how we're doing and making sure that we are getting you guys all what you need. So if no one else has any other questions, we will end for the day, and thank you for attending.